Tonight we have part 2 of a CBS News investigation that we broke right here last night. Active duty troops and vets are being prescribed dubious drugs at astronomical cost to taxpayers. The medications are concocted by compounding pharmacies, which make custom prescriptions. Tonight, Jim Axelrod questions one of the doctors prescribing these drugs.
They're targeting our troops and they're targeting our taxpayers.
Major General Richard Thomas oversees TRICARE, the military's health benefit system. He says marketers peddling pain and scar creams directly to military personnel cost taxpayers hundreds of millions of dollars a month.
They're getting providers, doctors, or whomever to write scripts, fill in scripts without even seeing the patients.
But then those doctors are complicit as well.
Oh, absolutely.
To find out who these doctors are, we filled out an online form using a New York address, requesting pain and scar creams from a website called Healing for Heroes. 2 weeks later, without ever seeing a doctor or even talking to one, I got this package from How You Pharmacy in California. Inside, the pain and scar creams with my name on them, prescribed by a doctor named Paul Bolger. He runs a weight loss clinic in Davenport, Iowa.
Hi, you Dr. Bolger?
Who are you?
I'm Jim Axelrod with CBS News.
Right there.
When we visited Dr. Bolger's office last week, he agreed to answer a few questions.
Doctor, how does this square with your training that you would write a prescription for somebody you had never met?
Well, I'm not disagreeing with anything you're saying. I'm not disagreeing with anything you're saying. And this is why I changed my practice.
What I'm saying is that you were doing something wrong.
I couldn't disagree with that. Yeah, you know, I'm not going to make excuses for what I was doing. It's not that I had bad intentions. It was that I was under the mistaken impression that that patients such as yourself were being spoken with by a qualified medical provider, someone who's qualified to screen you, do a intake over the phone, and make sure that you are safe to have these meds.
Dr. Bolger told us he has sent prescription requests like ours by a service that pays him to review patient files from states where he's licensed. New York is not one of them.
And I'm only supposed to be sent prescriptions from the states where I'm licensed. And unfortunately, in this case, one time I got a prescription from a state where I wasn't supposed to.
You're telling me this is the only time that this has ever happened, where you've written a prescription for someone who does not live in a state where you're licensed?
It's the only time I'm aware of. Because
Dr. Bolger said he had no idea the U.S. military was billed for prescriptions he writes, but that he does know he is not the only one writing them.
You're coming to see me, but I can tell you there's hundreds of physicians doing the same thing right now. I believe that probably almost none of them understand the process.
Dr. Bolger says after we contacted him, he changed his practice and now only writes prescriptions for patients he calls himself. Dr. Bolger also said he isn't paid to write the prescriptions, just review the patient files, and he gets less than $50 each. As for the How You Pharmacy, management there did not respond to our requests for comment.
Jim, fascinating report. Thank you very much.